So my research team and I were interested in evaluating racial and ethnic disparities in cancer treatment delays or discontinuations among cancer patients who were diagnosed with SARS-CoV-2 infection or eventually COVID-19 at some point during their cancer treatment trajectory. To answer this question, we leveraged the ASCO survey on COVID-19 and Oncology Registry, which is a data set that was curated by the American Society of Clinical Oncology and funded by the Conquer Cancer Foundation. Based on our research question, after we did all of our analyses, we found that there were indeed racial and ethnic disparities. In fact, compared to non-Hispanic white cancer patients, non-Hispanic Black and Hispanic or Latinx cancer patients were more likely to experience a treatment delay or discontinuation during the COVID-19 pandemic. And that's important because we were able to take into consideration important covariates that were measured through the ASCO survey and registry, which include things like their age, their sex, their cancer type, whether their cancer was progressing at the time of their SARS-CoV-2 infection, whether they had metastatic disease or not, where they received their cancer treatment. So we were able to take into consideration rurality. And importantly, we were able to take into consideration how severe their COVID-19 disease was, meaning were they sent to the ICU? Did they receive mechanical ventilation, or did they die due to their COVID-19 diagnosis? And that's important because when clinics were asked, why did the specific patient experience a treatment delay or discontinuation as it was documented in the survey or the data that were collected, over 90% of them reported that it was due to their COVID-19 disease. But since we were able to adjust for that in our modeling, that doesn't appear to be the case, or rather the data do not suggest that that's the case. Therefore, as a next step, my team and I are really interested in evaluating the patient experience or asking patients themselves why it is they may have experienced a treatment delay or discontinuation during the COVID-19 pandemic. Yeah, and I look forward to sharing those results when we have them. Thank you.